Hello, my name is Dr. Dewan S. Raja. Today I will go through the anatomy of the temporomandibular joint, also called TMJ. The TMJ is a synovial joint of condylar variety. It has articular surfaces. These are the condyle of the mandible, that is the head of the mandible, articular tubercle of the temporal bone, and mandibular fossa of the temporal bone. The articular surfaces are covered by fibrocartilage. They are not covered by hyaline cartilage. So this is a synovial joint of condylar variety. We may also accept it as a modified hinge type of synovial joint. So it has ligament like that of the lateral ligament, fiber going downwards and posteriorly. It is the fibrous capsule. There is also a ligament. We have the sphenomandibular ligament. We should have the stylomandibular ligament, not shown here. Okay, and the movement of the temporomandibular joint is mostly done by the muscles of mastication, like that of the temporalis masseter, lateral pterygoid, medial pterygoid. So again, articular surface here. We have to find out the articular surface. This is the tubercle, articular tubercle here. This part. This is the mandibular fossa here, and underneath the capsule we have the condyle of the mandible, that is the head of the mandible. Okay, so the temporomandibular joint has an articular disc that divides the joint cavity into the upper joint cavity and the lower joint cavity. The lower part of the joint allows hinge-like depression and elevation of the mandible, this part. The upper part of the joint cavity allows the head of the mandible to translocate forward into the articular tubercle. This is the articular tubercle, and backward into the mandibular fossa. This is the mandibular fossa. So this is the mandibular bone. This is the temporal bone. This is the temporomandibular joint. This is the intra-articular disc. This is a fibrous tissue. Okay. So joint capsule has two parts: synovial membrane, fibrous membrane. Synovial membrane lines all non-articular surfaces of the upper and lower compartment of the joint and is attached to the margins of the articular disc. The fibrous capsule encloses the temporomandibular joint complex and is attached above along the anterior margin of the articular tubercle, laterally and medially along the margin of the mandibular fossa, posteriorly to the tympanosquamous suture, below around the upper part of the neck of the mandible. So these are the attachment of the fibrous capsule. Okay. So we have to go through the ligaments, blood supply, nerve supply. Ligament, we discussed that, fibrous capsule, lateral temporomandibular ligament. Okay, so this is medial view. On the other side, we'll get the lateral temporomandibular ligament. Okay, so lateral temporomandibular ligament is very close to the joint. The sphenomandibular ligament. This is the sphenomandibular ligament from the spine of the sphenoid bone to the lingula of the mandible, just over the mandibular foramen here. The stylomandibular ligament from the styloid process to the angle of the mandible. This is a stylomandibular ligament. Blood supply from the terminal branch of the external carotid artery. What are the terminal branches of the external carotid artery? Superficial temporal artery and the maxillary artery. Nerve supply, branches of mandibular nerve, like what? Like the auriculotemporal nerve, the mesenteric nerve, the deep temporal nerve. So we got the blood supply, nerve supply. Okay. Now we'll go to the movement of the temporomandibular joint. Elevation. This is elevation, that is closing the mouth. What are the muscles? Temporalis, masseter, and medial pterygoid muscle. Depression. This is depression done by what? Lateral pterygoid. We'll add one word here. Lateral pterygoid here. Lateral pterygoid, gravity, digestive, genuhyoid, and mylohyoid muscle. Protrusion. Protrude the chin. This is the protrusion. It is done by lateral pterygoid, masseter, and medial pterygoid. Retrusion, that is this, okay, retrude chin. It is done by the temporalis masseter in the site of the, in the living body. Here is the site of the temporalis. Masseter should be here, okay. Lateral movement, grinding and chewing. Temporalis of the same side, pterygoids of opposite side, and the masseter. So these are the movement of the temporomandibular joint. We have elevation, depression, protrusion, retrusion. We have side-to-side movement. We have grinding and chewing movement. Okay, we got that. We'll learn some clinical anatomy because this joint is very commonly, this is the most used joint in our body. We use this joint every time, every hour, okay, almost. So we have to learn some clinical anatomy. The temporomandibular joint may be dislocated. Dislocation may be two reasons. One, some people bite on a hard bone or big bite, or their ligament may be very weak due to any reason, okay, due to old age or due to the ligament capacity has been decreased. So in that condition, there may be dislocation of temporomandibular joint. If they bite, they have big bite, they are attempting to grind a big piece of bone or the meat. It may be, there may be chance of trauma to the temporomandibular joint, any type of trauma, okay. Arthritis to the temporomandibular joint, that may damage the articular disc and it will damage the architecture of the temporomandibular joint. Protection of these are the possibility. We have to also remember some of the clinical anatomy, especially for the surgeon when they do surgery. Protection of facial nerve, because facial nerve is easy, it is branched out inside the substance of parotid gland. It is coming out through the stylomastoid foramen, so it may be involved any type of trauma or surgery in the temporomandibular joint. And the auriculotemporal nerve, mesenteric nerve, and deep temporal nerve, these are the branches of mandibular nerve that should be protected by the surgeon during surgical operation. Okay, and that's all about the anatomy of the temporomandibular joint. We have to know in details about temporomandibular joint. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. And have a nice day. Bye now.